17% of the premature mortality is caused by diarrheal disease. In contrast, lower respiratory infections cause 20% of premature mortality. So you've got years of life lost on the one hand, but societies also spend a significant amount of resources on keeping people alive and healthy into old age. And so you need a metric to quantify whether we've been successful at doing that or not. So that's where the burden of disease came up with something called the years lived with disability, which is simply the prevalence of a condition multiplied by the severity of that condition. So if you're living with schizophrenia, you're living with less than perfect health. So it quantifies the amount of a year you live with less than perfect health. So if we switch to years lived with disability, the picture changes dramatically. We now see a profile dominated by mental and behavioural disorders at the global level. So 34% of the disability burden in ages 15 to 19 is from these mental and behavioural conditions. So if our questions are more specific, we want to know exactly what the conditions are. So as you might have guessed, it's unipolar depressive disorders, 15%. Anxiety disorders at 6%. But there's also a significant contribution from drug use disorders in the younger age groups. And also from alcohol use disorders. And then down the bottom here is schizophrenia. Despite having the highest rated severity of any health condition in the burden of disease, the prevalence of schizophrenia at the global level is relatively small.
Can you show that one with numbers, the one before with numbers rather than percent? Just interested in it.
Numbers of YLDs?
Yes, thank you. Yeah. The previous one that showed all contributors to YLDs, you showed it as a percent.
Oh, right, sorry, yep.
Yeah, sorry, just interested.
Yeah, no problem.
For me to actually find it on the web, it's quite hard to ask you to do it.
Yeah, sure, no problem. I mean, you know, this is a small group, so whatever you're interested in, let's...
Numbers, that's the one, yeah.
Oh, numbers, sure. Yeah. So these are numbers of years lived with disability, not prevalence numbers. But then, so you've got the mental and behavioural disorders, but then you've got the musculoskeletal disorders, which if anyone's had low back or neck pain, you can appreciate is quite disabling and quite prevalent.
Could you show the different mental illnesses?
Yep.
Just for Australia.
Just for Australia, sure.
Because I know schizophrenia really quite a lot of research funding, and I had always assumed it was because it was so disabling. But if it's if it's still relatively low compared to the burden of depression, then that's quite interesting.
So this is the disability for just for mental and behavioural.
Yeah, so it's still
schizophrenia. It's still pretty low. Yeah. What you don't see here is self-harm, suicide. But so suicide is coded under intentional injuries, which is interpersonal violence and self-harm. So in Australia, years lived with disability. If we switch to premature mortality, you see pretty dramatically that.
But so self-harm is coded as its own thing rather than as a result of, like, self-harm deaths don't contribute to depression.
So,
burden of depression.
So one can argue that depression is a risk factor for self-harm, but the way that that it's coded in burden of disease, you can only have one cause contributing to an underlying, the underlying cause contributing to the death.
So what are people who commit suicide coded as?
Deaths from self-harm. Sorry.
Right.
So that
they don't contribute to
death,
burden of depression.
Yeah, that's right. Yeah.
Okay.
Yeah.
That's interesting.
Yeah. There's a paper recently that just came out in The Lancet that talks a little bit about this. Harvey Whiteford is the lead author. So, yeah.
Yeah, I mean, it's difficult with these things that have two causes. Like,
Yeah.
you can see cirrhosis in there that is treated as though it's its own thing rather
Yeah.
than the result of chronic viral hepatitis.
Yeah.
And
Yeah.
you've got HIV deaths that are apparently due to HIV rather than TB and
Right.
all of this.
Yeah. Interestingly, if you flip to somewhere like the Philippines, the picture is reversed for self-harm. So interpersonal violence is the leading cause of intentional injuries, and self-harm is down about 5%. Now, your self-harm suicide data is not great, I think it's fair to say, and the quality varies by country, of course. And some countries hide suicide deaths under other codes.
Can you show the US for that graph?
Yeah, absolutely.
That'll be uplifting.
About 50-50.
Did you show Japan?
Yeah. Not much interpersonal violence in Japan.
No, and a lot of,
Yeah,
a lot of
that's
suicide.
it's pretty amazing. Any other requests?
Would you
Yep.
mind doing it for men versus women in
Yeah,
one sort of setting?
Absolutely. Country, region.
Or even sort of the overview.
Overview. So let's go global. Interpersonal violence, self-harm, 50-50.
Wow.
Young women, 15 to 19.
Do you mind doing it with all the other?
Yeah. So remember, self-harm comes under intentional injuries, which is this salmon colour here. And this is premature mortality. So you've got premature mortality on the one hand, this is a good transition, and disability on the other hand. The way to bridge these two and compare conditions like suicide to depression or like suicide to alcohol use disorders is to combine it in a metric called the disability adjusted life year, which essentially one disability adjusted life year means 1 year of healthy life lost. And so it's the sum of the premature mortality and the sum of disability stitched together. So if we switch to that, then you kind of see the pictures merge together at the global level.
Could you compare that to the men then?
Yep. So this dark purple is the transport injuries. Men drive fast and drink, and I'm contributing to stereotypes, but it comes out in the data. Yeah, this is only war and disaster for 2010. So this is only at the single year.
Is conflict? No, it can't be. The countries that were blue in that global map of the increasing prevalence of non-communicable disease.
Yep.
So Central African Republic, South Africa,
Yep.
and I think Ukraine might have been one of the other ones. What? Do you know what causes that? Really dramatic decreases in the proportion of deaths due to non-communicable diseases.
The proportion of deaths due to communicable or non-communicable?
There were several countries in that map where the proportion of deaths attributable to non-communicable disease had declined rather than risen. The blue countries. No, not that one. The one that was mostly pink, and then there were a few.
Oh, right. This one.
That one. Oh dear. Yeah, so
Oh, okay.
South
So
Africa,
there's been
Zimbabwe, Central African Republic, and Ukraine.
Yeah, a decline. So there's basically remained the same, or from -4 to 0%.
Well, South Africa's gone more than.
And
10%.
South Africa more than 10%. Yeah.
So is that?
So they've gone from
HIV just.
Yeah. So this is from 1990 to 2010.
Yeah.
Yeah.
Okay. So it's HIV.
But we can investigate in more detail. Yeah, so this is one visualization tool. We've built a whole set. This is called the GBD arrow diagram. So this is essentially what I showed earlier. The colour coding corresponds to communicable diseases for the red, non-communicable in blue, and injuries in green. And broken lines indicate cause decreased, solid lines increase. So this is East Asia and Pacific, the leading causes of health loss. And you can see the transition really kind of clearly for East Asia and the Pacific. You know, ischemic heart disease has gone from 8 to 2. COPD, low back pain, major depression, lung cancer, diabetes has gone up by 76% from the 20th cause to the 9th cause. You can see that kind of in more dramatic detail for some countries. Fiji, I think, is one of them. 221% increase over that 20-year period. And then there's another tool that you can use called a benchmarking tool, which illustrates the uncertainty around these conditions. So I said that, you know, the evidence where the uncertainty is small, the evidence is strong, and where the uncertainty is large, the evidence is fairly weak. And anxiety disorders in East Asia and Pacific plus Australia, which is kind of in the middle of the pack, or down the bottom. It's hard to differentiate on this at the country level, just because there's not a huge amount of epidemiological information on anxiety disorders. A little bit more on depression. North Korea and Australia doing fairly well. So the green indicates better than the mean, and the yellow is indistinguishable from the mean.
Sorry, that's in terms of the burden of the data quality.
So this is the health loss due to opioid use disorders or previously depression, anxiety disorders. Looking at schizophrenia before. Again, the data is just not sufficient enough to differentiate by country. It may be better in Europe. Apparently not. Where is it? EU15. So Norway do the worst on mental and behavioural disorders in the EU. Yeah, so this is a really interesting tool to use to convey to policymakers how well their country is doing. So perhaps mental and behavioural disorders aren't a great example, but let's say somewhere like South Asia, you get a huge discrepancy for diarrheal lower respiratory infectious disorders. So Afghanistan and Pakistan, India and Nepal doing poorly, Maldives and Sri Lanka doing far better, Bangladesh and Bhutan. So it's almost like you can say to a policymaker in Nepal, well, this is what a country in your region has achieved. Then you can explore reasons for that. What has Bhutan done that Nepal aren't doing? What's their policy response been? What resources are they shifting towards tackling this condition? Okay, so I just wanted to kind of show you some of these tools. And this is all freely available to you to use and explore. There's one other tool that really nicely demonstrates the epi-transition. So this is a tree map with the size of the square proportional to the amount of health loss due to that condition. So I'll show you something pretty interesting. So I've changed the depth just to aggregate the causes for non-communicable diseases at the global level. There's a rough split, or about 50% of health loss due to NCDs and about 35% due to communicable and 11% due to injuries. If you fast forward to 2010, oh sorry, wrong button. Okay, we'll go backwards in time. In 1990, there was only 43%. This is much more evident in a place like China, where their profile of non-communicable disease in 1990 was already 60%. If you fast forward to 2010, that's now 77% of their burden of disease. So there's a rapid epidemiological transition happening in China. And then you can break out the causes. So stroke is the leading cause of health loss in China. Anyone interested in looking at different countries? You can see major depression is contributing 3% of health loss.
Could you show South Africa?
Yep. HIV is still contributing a huge amount of health loss. Violence also jumps out as a leading cause. Yeah. So yeah, another tool to explore the burden of disease results. Anyone have particular diseases they're interested in?
When you did say the depression results over 20 years,
yeah.
there wouldn't